So it doesn't really matter which side you start on. I just like to have the leg forward. And again, you're overlapping the ace wrap, trying to make it nice and clean, not a lot of wrinkles. And you'd use this for the quad strain, quad contusion sometimes as well, just to keep that compressive forces. Ideally, you'd like to allow it to end up high, but if it's right there. And then we have our stretchy tape. So the quad ace wrap is fairly easy. Yes, ma'am.
How does that differ from like the hip flexor?
He's not pulling it anywhere.
It's not
You're
going
just getting some compression on the quad.
Very good question.
So I don't have any pull, except for the fact that I put
It's just pressure.
Yep. Giving it support.
Okay. So that's the quad. Again, I like to start up high on the hip. When you're wrapping it, making sure that it doesn't overlap. Nice thing about this table, you can see that you're getting right where a hamstring strain would be with the ace wrap overlapping. You don't want to go down too far behind the knee, because then when they start running, it's just going to fall out. And then again, if you can end up high on the hip, that's less chance of it falling out. So that's your hamstring wrap. Or just the wrist tape. There's a couple different ways you can do it. Biggest thing is you want to make sure that they open their hand. When you splay your hand, it makes it so the tape's not going to be too tight when we let go. So just for a wrist only, there's two ways we can do it. You can do it continuous. Keep your hand right here.
Oh, you don't free wrap it?
No, I don't like to use free wrap. Sticks better to the skin. Okay? So that's the continuous. Pretty simple. Okay? Now you can do this strip tape. Basically, you're just overlapping the tape about a ½ inch to create a good secure base. And you do about 6 to 10 strips. If you're in a hurry, that's going to work better. A lot of guys prefer that, or ladies, depending on what their preference is. But that's the basic wrist tape support.
How much pressure are you putting with that tape?
You don't want to put a crank on it too much, because then you will cut off circulation. So I would say snug, but not overly tight, if that's possible. Pretty comfortable, correct? Pretty comfortable. So that's the wrist tape. What we're going to do is I'm going to add to this and show you the thumb. Okay? I like to just keep him in this position with his hand open. Basically, it's a figure 8, similar to what you do for the ankle. You're going to do for the wrist and thumb. You're going to encapsulate the bottom of the wrist, bring the tape around the thumb, and I like to pinch it because the tape won't dig into the web. Back and around. There's the circle right there for top part of the 8 and the bottom part of the 8. 2 to 3 times around is plenty for a figure 8 spica wrap for the thumb. Yes, ma'am.
What kind of injury would you be wrapping for this? Like a wrist sprain?
Wrist sprain, thumb, somebody that hyperextends their thumb. A lot of individuals just like it just so they don't, so it's more preventative. Yes, ma'am?
For the thumb, I know you were building off of the wrist, so that wouldn't be the right.
No, you have to build off the wrist. You can't just do figure 8s. You have to encapsulate it with the thumb, or with the wrist. I apologize. Because then it makes it more secure.
So it's
All one thing, yep. Just for time's sake, I just wanted to do that way. So that's the wrist and thumb. You can add for a hand, the opposite is you're going to be coming through the web of the hand rather than web of the thumb. And again, it's basically a figure 8. 3 to 4 times through. This is a hand. So you can see that the hand is now taped. There are individuals that like all 3, wrist, hand, and thumb. So you just do a combination of all of them. You would be tested on wrist, thumb, or hand. Okay? Let's practice.